hope. So let's get started. So welcome everyone to our monthly Living Well Before and After Transplant program.
And the dietitian at a dialysis center.
My name is Cindy Huber, and I'm the CEO of the National Kidney Foundation. I just want to review just a couple things for those of you that are watching us online. During the meeting, you'll see something that says participants. Right now, it looks like there's 24 people so far that have joined us. If you would like to put in your first and last name, we'll kind of know who you are. You can rename yourself, if you will. So if you have any questions, and on the screen you'll see how you can hover your mouse over your name and then click on the dot. Tonight, we're asking everyone if you could just keep yourself muted unless you're going to ask your question. But we're hoping that you'll also, if you are online, that you'll use the chat function, and then we'll share your questions with our speakers. Tonight, our speakers are very excited to have you interact with them throughout the presentation. Let's see. Yeah, I think, again, the direction there, if you don't want people to see you, let's say you're having a bad hair day, or let's say there's some distraction, you can see the directions, again, for those of you who are online, that you can just kind of hover over that stop video, and then you can turn your camera off. So if you are needing to do that, again, those are just, hopefully those are helpful tips. Next slide, John. And here I am on a much better hair day, and much better than I am looking tonight. But again, I want to welcome everyone. These are monthly programs that we offer for recipients or individuals that are waiting for transplants of all organs. Our goal when we started this program almost 17, 18 years ago was actually an inspiration by Dr. Alan Rosa, who is a physician in the transplant department at Froedtert, and a patient who felt that sometimes people just wanted to connect. They wanted to connect about information. They'd like a chance to talk and learn more, because there's so much information as you encounter and are starting on a transplant journey, once you're on the transplant journey, and post-transplant. So our goal is to, with your suggestions and input, the input of transplant professionals like the two you'll hear this evening, this is an opportunity for us to just, I think, join together, learn some new things, ask questions, learn from each other's experiences. So I appreciate you coming tonight. This is the commercial part. Since it's one of the prime days and everyone's shopping online, I just want to remember that, tell you the National Kidney Foundation is a nonprofit health charity. And I'm sure many of you are aware that the Amazon Smile program, so you can select a charity to support, and Amazon makes a donation every time that you shop, if you will. So it's not adding on to your purchase, but it's a contribution that Amazon makes to nonprofits that are registered. Happy Prime Day, and so I hope you've done some shopping today, but I would really encourage you to, whether you pick the National Kidney Foundation of Wisconsin to support or pick a local favorite charity, Amazon Smile is a great way to support local or national charities, anything that's close to your heart. Next slide, John. This is a program no matter where you live in the country, so Ohio or Houston, Texas, or wherever. If you have a neighbor, if you have someone in your family at some point that wants to if you will, recycle, get rid of their car, truck, motorcycle, etc. When you call that 800 number or go to kidneycars.org, you'll be benefiting patient programs in that particular state. So even in Northwest Ohio, if you donated a car or got someone to donate a car, you're helping patients in that state. So again, another way that you can spread the word and be an ambassador to help kidney patients throughout the country. Next slide, please. Tonight, I'm excited to welcome two outstanding experts and amazing people that give not only during the day, but give of their time, as you can see, in the evening. And so, Allison and Samantha, first of all, thank you from the bottom of my heart for volunteering tonight and sharing time with us. Time that you could be spending with your family, but giving back as you do all during the day, but giving back to patients through this program tonight. So I'll turn it over to you and let you unmute yourself and introduce yourselves. So welcome, Allison and Samantha, and thank you for joining us.
I don't see me muted. Can you hear us?
Yes.
Okay, I didn't have to unmute. So my name's Allison. I am a social worker at Froedtert. Oh, and there we are again. And so I work with pre and post-transplant patients who have had liver, kidney, heart, and lung transplants. I work mostly with our liver patients and kidney donors. But we cross cover and we see all areas in my work. I'll let Sam introduce herself.
Hi, I'm Samantha. I'm a post-kidney transplant coordinator. I work with our kidney transplants after they get their transplant. So I actually help my patients on a daily basis with how to deal with the struggles of COVID and the world we're living in today.
All right. Next slide, please. All right, so today we really wanted to just sit and talk to you a little bit about how to consider all of the things going on with COVID when you're planning for the holidays, how your plans may change because of COVID. And so we've taken a lot of different topics. We want this interactive, so please, if you have questions, type them in. We're happy to kind of participate with you as we're going along the way, because I'm sure there's lots of questions about how to navigate the holidays with all the restrictions in place. Nope. All right, next slide. Oh, there we go. We talked about, I think the title was Time, Space, People, Place. And so we're kind of, I've separated things about by those topics. And so with time, we are definitely in unprecedented times. There's a lot of unknowns with COVID that I think have a lot of fears, especially for those that are immunocompromised or have other health issues that make you a little bit more vulnerable and don't know exactly how COVID would impact you if you get COVID. And so there's still a lot of unknowns of the recommendations, how useful they are, what's good, what's wrong. There's a lot of questions that are going on. And obviously there's a lot of different opinions about how people should be living during these times. Which when I've had conversations with many people, that can be quite frustrating when they have loved ones, family members, friends that don't share their opinions on how to be safe during times like this, either if, one extreme or the other.
I would like to just note how on the bottom of the slide there we have, do you limit your time at these events? So does anybody know what is considered being an exposure to somebody without a mask on? How long do you need to be around someone without having a mask on within that 6-foot radius for it to be considered an exposure.
And feel free, if you're on your computer, to type that in.
Anyway, yes, perfect, Anne. Yep. So that 15-minute window, that is being within a 6-foot radius for 15 minutes without having a mask on. And so that's something to consider when you are with your family. Just making sure that you're being cognizant to tell people, you know, I really do want to spend time with you. I want to be able to have these memories with each other. Let's just make sure that we have a mask on so that we can be near each other when we're doing so. Next slide.
So other things to consider when you are planning events, or if you should go to events, these are some questions that Sam and I had thought about, you know, as things that you are considering of whether or not you want to attend, or how long you should attend. So, you know, knowing how many people will be there. At least I know there was a recent change in Wisconsin that the governor ordered, and of trying to get a little bit more strict as far as groups of people, how many should be around each other at the same time. And obviously that's going to be different state to state. You know, and how well do you know the people? Are they as close family and friends? Are you having a big social gathering where you know you don't know people very well? That is a good question, Kim. Yeah, how do you eat? You know, you know, and that's something you're gonna, you know, we always want you to be 6 feet apart from people when you take your masks off to eat. So that way it eliminates the risks of exposure. And sometimes that's harder to do in some setting than others.
And one thing you can do, so that's a perfect example, as someone had just mentioned, like putting masks by the door. If you have, for example, a large family, maybe you can prepare ahead of time to talk with the person who, for example, might have the most amount of space in their house. For example, having different floors. And although it may seem strange, maybe you can set up a TV tray with, you know, some other people upstairs that you can still eat and remain socially distanced throughout the house. But then people will still have their masks available for when they're not eating, or even just trying to have an equal amount of people in the room who, you know, taking turns on eating. Okay, I have my mask off, you have yours on, and every other person. I see a question about the prayers or blessings at the meal. What you could do is, again, just try and have somebody within the house saying the blessing, or say the blessing with your mask on, and then have people disperse to eat.
You know, kind of going down some of these conversations, you know, obviously we would hope that everyone who's attending the event is healthy. If people are showing signs of COVID or other illnesses, you know, especially for all of you post-transplant patients who are immunosuppressed, we always recommend to be around healthy people anyway. Even before COVID, that was a recommendation. So, you know, hopefully people who aren't feeling well are going to stay home, you know, or, you know, ask them to if that's something they're considering. So that way that also eliminates risk. You know, who's preparing the food? How is it being prepared? Or is it getting catered? Those are things that, you know, to consider as well. You know, or, you know, I like that is.
I know that like a lot of, a lot of times when you have these big meals, like you have Thanksgiving, you have Christmas, you know, New Year's, any kind of meal that you celebrate, you want to try and bring in types of like really like snack foods. And a lot of times these things are not individually wrapped. So really trying to be cognizant of asking whoever the host is if they can spread the word to request individually wrapped snacks, such as if you're going to be having, for example, like vegetables? Can we have everybody has a separate tray or a separate plate that's pre-set up ahead of time, or even little baggies with vegetables, for example, and just making sure that that one person who is not having any signs or symptoms of COVID, they washed their hands, they wore their mask when they were preparing the food, and then preventing having additional people touching the different options. We want to try and reduce that hand-to-hand contact as much as we can. I saw a question about the gym. Did someone ask something about the gym?
Yeah, sometimes I will tell you those questions pop up so quick it's hard to read them and process them.
Yeah, it says, what if there are people being active, like going to a gym, seeing friends, going to restaurants? They may be healthy, but could be asymptomatic.
Oh, yeah, you know, and that's a concern that I've heard from a lot of people as well. And that's kind of where that last bullet point of everyone having different opinions on that social distancing and what that's looked like, because you do have, you know, a lot of people who are trying to do their best and go to the point where they're barely leaving the house except to go to the doctors. They're getting all their food delivered and shopping online and barely leaving the house. And then you have other people who are living their life and pretending COVID isn't impact, you know, doesn't have any impact on their life. And that can be very worrisome when somebody who is really doing their best to limit exposure to see somebody who is going to all of those different places. The hard part is, you know, no matter where you are in that belief system, you know, there's a range of beliefs. Everyone is going to have to kind of respect each other a little bit to try to make it happen. And if you have to feel comfortable with what you're going to do. So if you know there's people there that are living their life a little bit more precariously than you feel comfortable with, that's a decision you have to make of whether or not you want to attend that event if they are attending that event. You know, because you can try to do education and let them know the reasons as somebody with chronic health issues of why you feel the way you do and why you take the precautions you do, but you have no control about how other people are going to live your life. And so that can be very challenging when you're trying to see family and friends, but they don't share those same beliefs and are living the same lifestyle you are at this time. So there's really no easy answer to that other than you need to do what you feel most comfortable with.
And I have had patients that I saw somebody has family members that work in the hospital setting, or, you know, people who are going to the gym. So the simple fact of wearing your mask, making sure your hand sanitizing, keeping your 6-foot distance, those are all precautions that we're taking, having the thought in mind that the people around us have the virus. So if you constantly have in your mind, every single person here is asymptomatic with this virus, and you remember that, and you take those precautions, such as the social distancing, you're wearing your mask, you're washing your hands, you're doing everything that you can do to prevent from getting the virus, you're really going to feel satisfied in how you have been preparing yourself, because these are the guidelines that the CDC is recommending to prevent from getting the virus, even for people who are asymptomatic around them.
Let's burn it and then.
Next slide.
Look at the.
Other things to consider would be place. Where is the event being held? I think, you know, Sam had kind of talked a little bit too, versus, you know, like what home you're going to be in. Can you choose a larger home that has more space so you can spread out a little bit? You know, is it a public event? So depending on that, are you able to leave easily if you are feeling uncomfortable or unsafe? You know, are there virtual options versus in-person options? So that way you can still see friends and family. It's definitely not the same as being in the same room. You know, I think we're all noticing that, even, you know, doing these visits and these presentations. This is my first one that I've been doing virtually. All the other presentations I've given have always been in person. So we've all been making accommodations. But definitely for the holidays, that just makes it hard, because I think there's just, you were so used to being able to provide seeing friends and family in person around this time of year.
I saw someone had a question about the hugs or kisses with grandkids and family members, and that's a perfect question. Obviously, you really want to see your grandchildren. You want to give them hugs. You want to give them kisses. However, we know that children are typically little germ balls, and so we just have to keep in mind that, you know, if you do want to give your grandchild a hug, are they wearing a mask? Is it quick and then distancing yourself? But then also taking into consideration, is this something that I want to risk getting the virus for? How long is it going to be that I'm not going to be able to hug my grandchild for? Even when it comes to saying hello to other family members, one of the things I recommend is kind of doing a little elbow bump. They say we're not supposed to hug, we're not really supposed to shake hands. But if you just do an elbow bump, it kind of still gives you that same feeling as greeting that other person, really making your presence known with them, and that you're accepting them into your presence without really putting yourself at that high of a risk. So the recommendation I always give to my patients is, if you, for example, are seeing your grandchildren and they're from out of state, and who knows the next time you're going to see them, it's really up to you to weigh that risk. Do I want to risk getting the virus if my grandchild has it by giving them a hug, or do I want to say, you know what, I'm going to tell them, I'm going to wave at you from a distance, I love you, but I just at this point I'm not ready to hug or give kisses yet. And really trying to explain at a level that they'll understand.
Oh, so we just got asked about carpooling to an event. So that's another good question. And so, you know, if you're all in the same household and you're not social distancing at home, that's one thing. If you're picking somebody up, you know, again, you're going to be in a short space with each other. We would encourage you to wear masks while you're in the car.
And if it's a nice enough day, try and crack the windows. You really want to try and have as much airflow as you can. I understand that, I mean, although around Christmas it hasn't been that terrible recently in Wisconsin, but try and crack the windows if you can. Make sure you've got the air cycling. The worst thing you can do is to just have that kind of like static and sitting air. Traveling out of state.
And hotel stays.
Yeah, so I actually have a few patients who have wanted to travel, and I don't work for any airlines or anything, but I have heard that Southwest is doing a really good job actually at cleaning off their seats and all of their trays, booking only every other seat, and then I have been told that they're like rotating the airflow more frequently. I just generally tell my patients, as I had said before, pretend that every single surface and every single person that you see has the virus. So literally you sit down on your chairs, you get up, you use your hand sanitizer. Anytime you want to put a snack in your mouth, you wash your hands beforehand. Whenever you get home, you take off your clothes at the door, you get to your destination, take off your clothes at the door, take a shower. Really just keeping that thought in your head that every single person and everything you touch has the virus on it, and doing your best to keep yourself safe.
So in taking a car versus a plane, if that's feasible, definitely limits the exposure of being in that recycled air on a plane or being with strangers. But sometimes that's not always possible. but definitely another option to consider if you are going out of state. Other things also, because different states have different policies and guidelines. It's something to do a little bit of research if you are thinking about leaving the state to visit family, to see what is going on in that state, and what those recommendations and requirements are before you go.
Okay.
And so the last is space is kind of related, very similar to place. Oh yeah.
You can call your transplant coordinator with questions or send a my chart message.
Yeah, please, that, and that's a good, we always encourage, you have questions, your transplant team is definitely a good person, or, your primary care doctor as well. And I'm sure, I know most of the people on the call are, have a transplant coordinator, but if you're a donor and you're years out and don't have a coordinator, your primary care doctor is definitely another good resource for you. And so other things with the space at events is kind of, the space to people ratio. Are you able to social distance? Are you able to keep your 6 feet distance away from people as you are socializing? If it does happen to be a mild day out, are you able to get outside while the weather is nice for a little bit? Which I said, yeah, at least, Wisconsin, it does get a little bit limited. Those of you down south may not have to worry about it as much with the weather, but I remember actually Christmas Eve being out on the deck with my family last year.
Oh, yeah.
So it was very mild. So maybe we'll be blessed with mild weather this holiday season to help be able to have some fresh air while we're trying to socialize with our friends and family.
One thing I wanted to touch on that's on there is just about, so a lot of times when we're at these different events for different holidays, I know with my family, we kind of do like a buffet style. Like we put everything on the island and then everybody goes up in line and picks out what they want. So one thing to consider is kind of having almost like, if you've ever been to like a big event where they say like, okay, table 1 can go, and they kind of let people stagger up there. So maybe just allowing 1 or 2 people at a time going up to get food, and then keeping in mind after you're touching all of those utensils that somebody probably touched it before you, and making sure that you're washing your hands before you eat or utilizing that sanitizer. You could have one person serve for like a buffet style if you wanted to do that too.
Yeah. That would be helpful. Have one server, so there's one person touching the utensil versus everyone doing that individually.
The only thing I think with that would be if for some reason that person was an asymptomatic carrier of COVID, just obviously making sure that they are doing their best to continue wearing their mask. And I still would even, when in doubt, just put hand sanitizer on. Keep it in your pocket. Squirt it. When I get in my car, I put it on. The other thing that I would want to recommend, I can't remember if it's on an additional slide, but when you go to these kind of events, say you're driving in the car, I would recommend just having like Clorox wipes with you to wipe down your steering wheel. You can wipe down your gear changer. Is that on this next one? Oh yeah, it's on this one. Thank you. Making sure you have those antibacterial wipes with you to wipe down those commonly touched areas, even if you're just kind of living your life right now, not necessarily going out for the holidays, and having an extra bottle of hand sanitizer with you pretty much at any time, because if you can throw it on after touching any kind of surface, it really is probably better. The other thing that's on there is make sure that you're not trying other people's food or drinks. I know a lot of times at these family events, it's like, ooh, I have this, you want to try it? Or, oh, he made me a really good brandy old fashioned, you want to try it? Don't do that. because that's the perfect way to be able to spread different germs and viruses and bacteria to each other. So really just make sure that, you know, you're not giving your granddaughter some of your mashed potatoes from your spoon, that you're really letting that person use their own materials, and then also using their own glasses as well. We did put on there that if you can bring your own beverage cup so that you know specifically what cup is yours. I know that can be challenging, as well as if you have, for example, you're hosting and it's really easy to just buy disposable cups, and then every single person has the same disposable cup, but then we put permanent marker on it, and an hour later from all of the moisture it rubs off. Whereas if you buy yourself a big obnoxious, you know, tumbler or something, you know which one is yours, and you're gonna know that other people aren't picking it up to grab it as well.
Yeah. No. Next slide. Is it? Oh.
Okay. So when you're leaving, like I said earlier, just make sure instead of giving hugs or kisses, if you can refrain, try and do kind of like the elbow bump, away from a distance if you can. As I said, make sure you've got some hand sanitizer in your car, wipe down your surfaces. I even recommend wiping down your door handle when you get home. I'm a big fan of using some Lysol on your TV remotes or on your switches on the wall. And then when you get home, so it's been said that the virus can live on clothes. So say somebody coughs on their chair and then you sit down on that chair, well, now it's on your pants. So just rather be safe than sorry. When you get home, strip down your clothes, throw them in the wash, and go in the shower. And then just like I said, trying to make sure you wipe everything down and use hand sanitizer as much as possible.
And so, we just got a question about worshiping and then going to eat. So if you are going to a church service and then going straight to your event, you know, it's just important to continue doing all the things that we've been sharing with you, to wear your mask at the event, washing your hands in between and multiple times throughout the day, and continue trying your best to socialize and distance yourself safely.
One of the things I found with my patients as well is that our transplant patients are so well versed in keeping themselves safe, just because we're already immunocompromised, right? We already are at a higher risk than everybody else from getting sick all of the time. So as a transplant recipient, being on immunosuppressive medication, you know that you should be constantly washing your hands, not touching those common surfaces. Use your sleeve or your glove to open the door. As immunocompromised patients, we already know all this stuff, and so we kind of have a one-up on the rest of the population who hasn't already been, you know, keeping away from sick people, who hasn't been covering their mouth when they're coughing, or who has been touching that nasty handlebar and then eating a piece of string cheese without washing your hands. So our immunocompromised patients, they already have this one up, they already have this knowledge. It's just about being really cognizant and remembering to specifically do these things.
And we have another question. What is your opinion on visiting someone in a nursing home or a hospital?
Well, most of those facilities have their own rules and regulations. So you definitely need to follow those guidelines, and make sure that you are doing your best to be safe, to wear your mask if you are going to visit somebody, if you are able to, you know, wash your hands before and after you leave. You know, because especially when you have a loved one, especially over the holidays, I know that emotionally, a lot of people are struggling with not being able to see friends and family. They're very lonely. And I think especially people who are hospitalized for an extended time or live in a nursing home, that is a much larger issue, since they haven't been able to have friends and family and guests visiting them the way they're used to. And so you really need to just weigh those risks and make a decision. You know, as Sam said earlier, you have to decide if that risk of potentially getting the virus is worth it to you. Is seeing that loved one and spending that time with them, is that a risk that's worth taking? Only you can decide that for yourself.
Especially when we have loved ones in the hospital. And I saw someone who had mentioned, what if I have, you know, my 90-year-old grandmother come to my house? Again, it's up to you and your mom or your grandmother to determine, you know, are we willing to take this risk to see each other in person? And I am an advocate of, as long as you're doing everything you can to protect yourself, if you see that person and you just so happen to get the virus, at least you know you did everything you could to prevent it and you were still able to see them. And you made that decision to be able to see them in person. Oh, no, live viruses are not good for transplant patients, especially if you're on immunosuppression. And I actually would advise against the COVID vaccine, and unless you speak with your transplant physician, just because we don't know what the long-term effects of this are going to be. But in general, no, our immunocompromised patients should not be receiving live viruses. It should be inactive viruses. And I did see someone had a question about the flu shot. I know that at our center, we do advocate for our patients to get the flu shot. It does vary from each transplant physician, though, how soon after transplant our patients should be getting the flu shot based on their induction therapy.
There's also a question, I don't know if you have any thoughts on it, about whether wearing gloves is better than hand washing.
What's your opinion?
I've heard different things. I would think hand washing would be better, just because you're cleaning your hands. And I think sometimes when you're wearing gloves, you kind of think, oh, well, I'm fine, I'm wearing gloves, but then all of a sudden you're touching this and you're touching that and you're touching this. And so
you think you're safe because you've got your gloves on.
Your hands are safe, but then if your gloves are contaminated, then you're contaminating everything you're touching with the gloves. So frequent hand washing is still gonna be best.
Oh, serving food during the holidays if one person is serving.
Oh.
Well, I mean, you could. As long as that person isn't, so for example, say in between person A and person B, this person goes over and takes a drink of their cup. Well, now they were, you know, they go over and take a drink of their water, whatever. Now anything that they touch with that glove theoretically becomes contaminated. So just pretend like there's some type of ink on on the glove, and anything that person touches gets stained with the ink. And so anything that they touch is then contaminated, or anything that is contaminated that they touch and then touching the utensils is then also contaminated. But in terms of, like, say, rolls, for example, I guess you could use a tongue. I don't know that wearing gloves would make a huge difference as long as it's just that one person touching the utensils, but that's why I'm not a huge advocate of gloves in general, is because once you have them on, you're like, oh, I'm safe. And then you touch your cell phone or you touch your glasses and then you're touching it.
Oh, I didn't see the end of that question. I saw what was the kind of best of eyewear. I didn't see the options. Is anyone able to reread that question?
Yeah, it says, I'm a healthcare worker and of course wear a mask at all times. What is best for eye protection, goggles or a face shield?
I don't know that it necessarily, I don't know that there's a specific recommendation. I think the goal of it is just to make sure that you're not getting any type of droplets into your eye. And really, it's more important if you're a healthcare worker that's working with aerosolized drugs. or you're doing bronchoscopy, something where you're getting that direct like sputum or particle in the air, in which case you should be wearing a more safe mask like an N95 mask. I really would just go based on whatever your employer's policy is for what you need to wear for your eye protection.
Sam, this is Cindy, I'm not sure I want to go back to a holiday gathering because we've gotten a few calls in our office about Labor Day gatherings. What if you go to a gathering and then either you hear through the grapevine or somebody in the family says, oh yeah, Bill tested positive, I'm a transplant recipient. Should I call my transplant coordinator if I find out after the fact then that someone may have developed symptoms? What would you suggest for me if I've been at that gathering and now I kind of either hear through the grapevine, I read on our family's Facebook page? What is your advice about that?
Yeah, first thing I would say, remain calm. Don't get in a panic. What I would then recommend is that if you were exposed to somebody who has a known positive, definitely quarantine yourself. Don't go around other family members just for the fact that you may very well now have the virus and be asymptomatic, so you don't want to get other people sick. But what I would recommend is closely monitoring your temperature. If you have a temperature over even 99, I tell my patients to call me. If you start to develop any of those major symptoms that are listed, the other thing is that right now influenza and COVID you cannot tell the difference between the two of them. And so if you do develop those symptoms of the cough, the runny nose, the body aches for sure, if you've got any loss of taste or smell, the headache, I would definitely call your transplant coordinator and just explain to them the situation, let them know the symptoms that you're having, and they'll more than likely tell you that you should go and be tested. One of the things that I know we've been doing for patients if they do test positive is we have them check their labs frequently and we adjust their immunosuppression so that your immune system can fight off the virus just enough, but then it doesn't realize that your organ isn't its own. So we do have ways of trying to help your immune system fight that virus, and we can't necessarily do anything until we see symptoms, and usually we are able to help the symptoms by bringing your immunosuppression down.
And so I don't know if you noticed that last question that popped up while you were talking, but somebody had asked how transplant patients have been doing who have gotten COVID.
Oh, yeah, I've had a couple. I have not lost anybody yet. I'm very diligent about calling my patients at least once a week, seeing how things are going, and then just, really giving them my best recommendations. I know for our patients, we do allow over-the-counter medications to help with some of that congestion. But really, like I said, with our increasing our lab frequency, I know most of our patients will be going at least once a week for labs, but then also adjusting immunosuppressive doses. I haven't had any losses yet. All of my patients have recovered and have done well.
So hopefully that provides a little bit of comfort.
Someone else had a question about how safe is outdoor dining.
Safer than indoor dining.
Well, I would also say it probably depends on the environment. There's a lot of things to consider. As that's something I have done a couple of times. There's one restaurant near my home that there's like 3 or 4 tables outside and they're very scattered. So that's something I feel very safe going into outside. And so, but I went somewhere with a friend over the weekend and we went outdoors, but it was still really congested and I did not feel as safe there. So it's going to depend on the location, and also, the wind and the breeze also can play a little role too on how germs are spread too.
At the end of the day, go with your comfort level. You know, if you are going crazy from being cooped up in the house and you have no food at home and you don't feel like going grocery shopping, and you can see that, you know, you've been wanting to go to this restaurant, they're doing really well at keeping the tables far apart, it's a nice day, you can eat outside. The only thing I would consider is, has the table been wiped off? Take your hand sanitizer with you. Really make sure that you're washing your hands before you're touching your food. Definitely outdoor dining is better than indoor dining just because there is that circulation of air. And then just trying to, you know, if you're sitting at a table with somebody, just wear your mask until your food gets there, and then just knowing that, you know, you're outdoors and hopefully you'll be okay.
And then in that vein, what about takeout?
Oh my gosh.
Well, I would think from a post-transplant perspective, the first thing that comes to me, you know, because I would hope that everyone who's preparing that takeout is doing all the precautions and wearing their protective gear to make sure your food is safe. But as a post-transplant patient, depending on what you're eating, just thinking about food temperature, how the food is cooked, how long has it been sitting? From that infection standpoint, that would be my concern as a post-transplant patient.
And in terms of COVID, so say you're driving up to a window to go pick up a fish fry, making sure that, you know, when you go pick up your fish fry and you're in your car at the window, you're still wearing your mask. If they need you to sign something, you know, you can use their pen, but again, having that hand sanitizer in the car with you. When you get at home, you know, you've got all your wings and whatnot in your styrofoam, keeping in mind that somebody could have coughed on that styrofoam and that there could be COVID on the outside of it. So washing your hands, using, you know, your own utensil to pick up your wings and don't eat wings, they're high in sodium.
Bad example.
Bad example. You're taking your piece of food that's not high in sodium and putting it on your own plate that you know is clean. Again, just keeping the thought in your brain that every surface that you touch has the virus on it, and you're not cleared unless you wash your hands or use your sanitizer.
And then we had another question about masks. So what about a cloth with 3 layers mask for a transplant instead of a N95?
Yeah, so actually, I think at this point, wearing a cloth mask is sufficient. It's really just making sure that you have that barrier, so that you don't end up having, if somebody, heaven forbid, is right next to you and coughs on your mask and their particles get out of their mask and into your mask, is unlikely, and you're smart enough that you shouldn't be standing that close to someone anyway. But just knowing that you have that barrier, and then like you said, if you want to have the 3 layers, that's better than just having a single layer. I know a lot of people have the misconception that there's actually a couple misconceptions. One is that the virus is, the mask is to keep me from giving you the virus, but it also works the other way, in that my mask is protecting me from you giving me the virus. It's really just that block. It's that shield to prevent any of that virus from getting from me to you or from you to me. So it does work in both ways.
I saw a question about how to wash masks.
Oh, cloth masks?
Yeah.
I put mine in the wash machine with hot water. They say hot water is the key because it's what would kill the virus. I know mine gets pretty.
Yeah.
Do you have any recommendations about board games or the family football game in the backyard? You know, but a lot of people enjoy those board games, you know, or etc.
Mm-hmm. Or I know there's that one at Christmas time now where people wrap stuff in like saran wrap and it's in a ball and you gotta.
You know, if that's something, you know, again, it's having a conversation with your family. You know, if you're going to play, make sure everyone washes and sanitizes before playing, and making sure they're not touching their face while they're playing. Otherwise, you know, maybe try to find other games to play that have a little bit less contact.
Like football would be a better idea than chess. Because at least with football, yes, you're touching the football, but, or if you say tackle somebody, don't do tackle football. You shouldn't do that with your organs. But at least you're distant.
Yes. So yeah, if you have your own dice for your games, you know, like I know one of my family favorites is Aggravation. So it's a board game, so it's got dice and marbles, if you're not familiar with it. And so we all have our own dice, we all have our own marbles. So if everyone just stays of touching their own,
And wearing your mask at the table.
wearing your mask at the table, and sanitize before you start playing, that would be a better option versus, you know, maybe like card games when you're passing around cards, the same cards over and over to people.
Yep. I saw someone had a question about elevators. Oh, yeah.
You know, so yeah, we were just kind of asked to kind of talk about the holiday blues, which I think is kind of normal for a lot of people this time of year regardless. And I think with social distancing, that is definitely likely to be something that a lot more people are going to struggle with. And so definitely, you know, be kind of aware of kind of how you're feeling. Do some self checks if it's something that you are struggling with, or you have a loved one who is struggling emotionally. That again, there are resources, especially as a transplant patient. We've got social workers, psychologists, psychiatrists available to help you through those things. A lot of our, I know at least at our center, visits are being able to be done virtually with COVID, so it makes it much easier to connect to those services than ever before. You know, to try to find things in the midst of feeling lonely or not being able to see the loved ones that you miss so much. Trying to find activities that bring you joy, to find some sort of activity or hobby, or if there's ways, you know, to do your best with, you know, phone calls or Skyping or, you know, video calls, whatever it can be. You know, it's definitely not the same as seeing them in person and giving them a hug like you would love to do. But finding those, and I'd really encourage you guys, if you are struggling with that, to ask for help. And I would also say, just even with that loneliness with COVID, even without the holidays upon us yet, we're seeing a lot of people who have increased symptoms of depression or anxiety. And if they're not coping well, they use some negative coping skills, increased alcohol or drug use or self-harm. And we definitely don't want to get to that point where it could be impacting your health and your safety. And so if that's something that you're concerned about, I know I have worked with patients with having some addiction issues, and that's something that many people feel very guilty about and don't want to, have a hard time talking to their transplant team about, because they don't want to feel like they're disappointing their team or not taking care of their organ. But I will tell you, as a transplant social worker, I would much rather have you be honest and ask for help so I can get you the resources you need, than for you to try to do it on your own, because it can be hard to do it on your own. And so definitely, you know, just find ways of coping, talk to someone whoever that might be, friend, family, as a social worker, a nurse, your doctor, a friend, connect with somebody somehow.
And Allison, this is Cindy. No matter how far out I am from my transplant center can always be my home. So even if I'm being followed, so even if I'm 10 years out, I can still call my transplant center, especially in this instance, correct?
Yes.
So my transplant center can always be my home, no matter how far away I am or how many years out. Am I correct?
Absolutely.
Perfect.
You know, hopefully, because somebody should be prescribing your immunosuppression, so you should be followed by someone. And if you're not, then you should be getting reestablished with a transplant center to get managed somehow. And so if you have lost contact with your transplant center and you need to reconnect, that is something the teams are always willing to do, because we want you to be taking care of that organ as much as we can, because we want you to be successful. So definitely, we're always a resource for you.
So ladies, any final thoughts before we go to the next slide? But you've done an amazing job tonight, and but any final thoughts?
One thing I wanted to share, it didn't come up for this, but I know just talking with a lot of patients throughout the several months, there are a lot of people that do live in fear that they are going to get COVID or have some really horrible lifelong impacts if they do get COVID. And so, which it definitely is a potential reality, especially with everyone who is, transplant patients, immunocompromised, or people waiting for transplant who have other chronic illnesses that put them at risk. But it's always good to kind of put things a little bit in perspective, because I know with the numbers that you hear on the news, they're scary numbers. And so I actually went to on the CDC website yesterday to kind of get a break of the most common numbers. And so sorry for those of you out of state, I just looked some Wisconsin numbers up. So as it's scary, these scary numbers are scary. As far as total cases in Wisconsin, there's over 155,000, and over 1,400 people have died in Wisconsin from COVID. But to put those scary numbers into perspective, only 0.02% of the population has tested positive for COVID in Wisconsin. 0.02%.
That's less than 1%.
Yes, a lot less than 1%. So over 99% of the population has not gotten COVID yet. And out of the people who have tested positive, 0.01% of those patients have died. So out of the whole population of Wisconsin, it's 0.0003%.
A really small number.
A very, very small number. Now, if, I don't want to make that seem like I'm dismissing the effects that COVID can have, because they are real and they are scary. But I think it's good to be able to put things into perspective as we're trying to figure out how to balance our safety with still living a life that's worth living. Because I've talked with other patients too, before and after COVID. The purpose of transplant is to give you a good quality of life. You want to honor your donor by living a good life and not leaving your house because you're in fear.
That's not a good life.
That's not a good life, and we don't want that for you. So it's learning how to live life safely with the things that we're doing. And so, I think what we've been saying over and over is, wear your mask, wash your hands, social distance, try to be safe as much as you can, and do what is comfortable for you.
Yep.
You have to respect other people's opinions, and sometimes that's hard to do when you may have somebody who's on the opposite spectrum as you, but again, you can't control that. So but I would really urge you all to figure out kind of that balance of how to live safely and still have a good quality of life. And so during the holidays, figuring out what that means to you with how those family events are going to look. Do you make them happen? Do you stay at home?
And a perspective to have of it is I always try and, as I said earlier, I pretend every surface has COVID on it. But I also try and go into each situation thinking, what if this person, heaven forbid, ended up with COVID? Would I regret not going? Would I regret not seeing that person?
So Sam, talking about being at home, there was an additional question about those college students. So maybe that can be our final question. Sam, is do I bring home the college students, and do I do it, how can I do it safely? And then we'll talk about next month's program. But Sam, I'm going to let you have the last word from the last question we got on Facebook.
Yeah. So I actually have had patients who, they have children that are in college and they want to see their children for the holidays. And it really just kind of goes with the same premise that we've been saying. If your children live in the house, try and ask them, hey, for 2 weeks, I want to see you, but I want you to be 6 feet away if you don't have a mask on. If you are near me, I want you to have your mask on. If you're bringing them home from college, keeping in mind that everything they touch could have the virus on it if they have the virus. So making sure that they're being diligent about washing, the faucets, washing door handles, washing remotes. Just making sure that they're aware that they are a risk coming into the house, being that they have been around college campuses, and just asking them to be respectful of, your potential immunosuppression and being in your own home. I know a lot of times when we're at home, we kind of let down our barrier because it's like, oh, well, I'm at home, so I'm safe. But I think it is important to be able to see your children, be able to see your grandchildren who are coming home from college, but just being aware that they could have the virus just like anybody else. And, if you tell them, hey, I love you, but I want to stay 6 feet away from you if you don't have your mask on, and use your own bathroom upstairs. Don't use my bathroom. And if you're using the kitchen sink, make sure you wipe it down. Just really being. So
we can love from a distance, right, Sam? So
yeah,
we'll
we can
show
love from a distance.
Okay. We're seeing a lot of nice comments, ladies, and hopefully we'll see more. As you can see on the slide that John has up, everyone, tomorrow you'll get an email with a quick link to a SurveyMonkey survey, and we'd love to gather your comments. Sometimes it's hard to measure the impact of our educational programs. And so I think your comments really help, as well as your suggestion for future programs. Ladies, I don't know if you've been seeing, but we've been seeing amazing standing ovations in some of the comments. So Sam and Allison, there's a lot of gratitude out here and around the country. From New Jersey, I've seen really comments from my friends like Jen Fredericks here in Wisconsin. A lot of people are very grateful for the time you gave tonight, and they're grateful for the honest information, and I think the perspectives that you bring from your professions as well as your personal life. So I hope people will take an opportunity to fill out the survey. Next slide, John. We have recorded tonight's presentation, so if you want to share that, if maybe you're part of a transplant group or share it with family members, we'll make those available on the National Kidney Foundation of Wisconsin's website. And next month we have a great program, and I don't know, Karen Isaacson, are you still on or not? But
I'm on. Hi.
Hi. So I want to point out Karen in her little box there on your screen. I've asked, go back, John, one, please. Karen, there you are. Do you want to talk about next month? Because we're really excited. You're a living donor and you're going to be our speaker next month.
Yes, actually, and actually my recipient, Monica Ashery, is also on the call. And so we're both here. And I'm a registered dietitian at the VA in Milwaukee. I work with dialysis patients. And in 2016, I became a donor to my dear friend. And we'd known each other for 10 years. So we're going to talk about a little bit about our story. And we're also going to tie it in with a theme on the holidays. And kind of looking at some of the recipes on the NKF website. And so kind of just wrapping a bunch of themes together, and we haven't quite fleshed it out yet, but we're gonna hopefully get some good feedback and ideas from the audience too, and so make it really interactive. So we'll try to keep it open like this.
So Allison and Sam, I hope you'll let recipients that you interact with at your institution know about this great program, because we're really lucky to be able to follow up your program. Next slide, John. I also want to let you know that the National Kidney Foundation of Wisconsin has a really active group of living donors, but also their purpose is to support people that are considering transplant, individuals that are considering becoming living donors. And back, John, one more, please. So these next two programs that are coming up feature, our theme is real people, real stories. So next week, we have 3 living donors who actually donated to a family member. They'll be sharing their stories, and you'll have a chance, or anyone that you know that might have an interest in living donation will have a chance to ask questions. And then on November 17th, we will hear from 4 individuals that are living donors that who gave altruistically. So they felt compelled to donate to someone to help them through living kidney donation. So again, I hope that those of you who are donation advocates, recipients, please share news about our Living Donors Together program. You don't have to be a living donor to participate, because really we have 1,800 people that are waiting in our state for organs, and it's important for us at Living Donation. I'm sure that both Sam and Allison will agree. They'll nod their heads. They might even jump up and down a little bit in their office. That living donation is a way that all of us, by promoting more awareness, we can save more lives through living donation. And so I hope that those of you that have joined us tonight, no matter where you live in the country, will tell people about those upcoming programs. So again, I want to thank everyone on behalf of the National Kidney Foundation of Wisconsin. Want to thank our speakers. Want to thank volunteer John Hacker, who is a recipient and volunteers and gives back to many organizations here in Wisconsin. And my colleague Amanda Pollock, who monitored our Facebook Live presentation. We couldn't do these programs without their assistance and the giving of their time too. So ladies, thank you again for joining us. Bravo, bravo for an outstanding, outstanding program. Thank you all for joining us. I hope you enjoy the rest of your evening. Good night.